Good evening, everybody. How is everyone? Natural fertility, natural solutions for fertility, natural ways to improve and enhance your fertility health is the topic. How is your fertility journey going? What are you doing right now in your fertility that is apparently looking not working for you? And how are you improving your health? We are talking about fertility health, we are talking about fertility solutions, ways to improve and enhance your fertility in a most gentle, natural, holistic way. My name is Ashish and my clinic is called Ashish Veda. We are based in central London in Harley Street, supporting women's health, couples' health who are trying to get pregnant and are looking for natural solutions, looking for other natural ways to improve and enhance, to support their journey with using herbal medicines, with using natural therapies that you can use to enhance your health and well-being. Both the partners, the man and the woman. Feel free to ask a question, say hello, tell me your experience of what you're doing right now to improve your fertility health, and what is it that you are thinking, what is going on in your mind, in your heart, how is it not working at present, and how is it affecting you as a person. What is going on in your fertility health? Natural ways of improving fertility health, and we are also starting our natural fertility coaching. The next 12-week course is starting in April, 4th of April. First 4 weeks of that course is free. If you are a couple trying to get pregnant and want to do things, learn a little bit deeper things about your health and well-being, you can join. First 4 weeks, which is half an hour session every Saturday for 4 Saturdays, is free for everybody to join. So if you are looking for that, if that is something that is of interest to you, then reach out with your name and email and I'll send you information related to that, and you can join us on a Zoom call. And you can continue either that journey with me or you can continue that journey on your own. But you will learn something in those 4 sessions. We will be doing teaching as well as some fertility meditation as well. 10 minutes every time. So that's the new thing that I am doing, and opening up more for women who are looking to get pregnant faster and healthier. So what kind of natural medicine have you used? What kind of natural solutions have you used so far? Herbal medicines, Ayurvedic medicines, Ayurvedic therapies, or any other kind of therapy, TCM, acupuncture. What have you used? What is the question for Saturday? Well, Saturday is not the day for questions, yeah? Okay. And for those who are looking for free resources, guides, some information, some more to think about, perhaps to realize what it is all about and how can certain things support you and support your health related to fertility, then check out my website ashishveda.uk. And when you go to the shop section, there are free guides and there are paid courses as well. There are free guides that you can download, egg quality, fertility, vegetarian recipes, and other guides that are available. So check that out as well. ashishveda.uk. Hi, hello. How can I help? How is your Saturday going so far? Here in the UK, it is called. I'm not a for weather person, but it is cold and dry, and it is very sunny today. So there is a lot of sun here. I hope wherever you are having great weather, or you are creating a great weather for yourself. Yeah, a great atmosphere for yourself. Natural fertility is what we are talking about. If you have a question related to your fertility health, related to your gynae health, related to your health of your partner, how he should be improving, feel free to ask a question. It is going to be a shorter live today. This week I've been doing some longer lives as I want to reach out to more women, to more people, to more couples who are struggling and can use natural medicine. But today's live is going to be a little shorter. Greetings, Lillian. I am doing fantastic. Thank you. I hope you're doing good. I hope everybody is doing good. 2 years since miscarriage, and we are trying to. Right. Delhi's Delight Restaurant. I want to ask. Please feel free to ask. How to open fallopian tubes if it is blocked. So blocked fallopian tubes, I've recently shared a success story of a patient of mine. So what you need to do is you need to look at your diet and lifestyle. That is the starting point. What you eat, how you cook, all of that, and your lifestyle as well. You can also take herbal medications which can help you if there is any inflammation that is there, if there is anything else going on related to your health that can be addressed with herbal medications. What works better for fallopian tubes is something that can be given locally. By locally, I mean that can be given vaginally, anally. And we give herbal medications like that. We do treatments and therapies like colonic herbal therapies. And also I give ghee and oil to be used vaginally as well for patients who are trying to open fallopian tubes. We also do treatment in the clinic as well, where we give medication inside the uterus to open fallopian tubes. And one of the things that can work really well with, if you do a saline flush, which is a modern technique, a testing and diagnostic technique, as well as we do herbal internal treatment, then both together can work out really well. So mind you, if the fallopian tubes, and there are other things that are going on, there is a lot of inflammation, sometimes we can't open the tubes, and sometimes tubes are not just blocked, but they're distorted, in which case we won't be able to open. But for a lot of things, tubes open up. A patient of mine recently had a wonderful result where a blocked tube was opened up just with herbal medications. So those are the things that you can do. But you need a practitioner who can guide you and help you with this. R.Cardinal. What else can I take beside Vitex to help ovulate? Everything I take that is natural gives headache. I don't know, our Cardinal, unless we have a consultation and I sit with you and understand your body, your constitution, understand your gut, understand what is happening with you. Vitex also is, if you're self-prescribing, I don't know how you are taking it, right? So all of that has to be looked at, and everything else about your diet and lifestyle has to be looked at. Vitex is only one herb. There are other herbs that can be used as well. Do you think fibroids can block fallopian tubes? No. Fibroids are in or around uterus, right? Either they are inside the uterine cavity, or they're inside the layers of the uterus, or they're just outside the uterus but attached to the uterus. So they don't affect much in fallopian, unless fibroid is very big and massive, in which case it will, yeah. In which case it will affect a lot of things. But I'm talking about very, very big fibroid. Generally speaking, no. Lily Snow, everything is normal, almost every test, but doctor is saying PCOS. You have had 2 cycles of letrozole, right? Why is doctor saying PCOS if every test is normal? You have polycystic ovaries. Has insulin resistance been checked? Testosterone levels being checked? How other symptoms are? How are your other symptoms that has been checked? Menopause, menopause. I'm 39, right? Lily Snow, FSH and LH is abnormal. Testosterone, normal. Prolactin, normal. Right. Lily Snow, then we don't know until we discuss your whole lifestyle, other habits, and see where the issue is. Also, remember, for fertility, we need the sperm also, a good healthy sperm. So if there is no insulin resistance, and then then there is possibly no PCOS. It may be that only the ovaries are polycystic, but you don't have polycystic ovarian syndrome, the whole thing. Yeah. And if you're not able to get pregnant, then you need to get your husband checked. Has your partner been checked? Yazzie, I just got my uterine polyp removed. How long will it take me to conceive? You need to have 3 good period, good flow for 3 cycles, and then you will be ready to start conceiving. How long will it take you? Nobody can tell you. Lily Snow, get your husband checked, please. Sperm analysis. Because without his sperm, it is not going to happen, right? Please reply. What was the question? My egg no work? You are in menopause, then egg will not be working. Delhi's Delight Restaurant. If someone is diabetic patient, but normal range is 120 in the morning, can get pregnant or not? If someone is diabetic, getting pregnant is harder, and also you lose pregnancy because you can't balance your blood sugar levels. Diabetes is a red flag for getting pregnant, staying pregnant. That's why it's a high risk pregnancy as well, because there are more chances of losing that pregnancy. Also, you have more chances of having high blood pressure when you have diabetes as well. Yeah. Sona, I don't know what you are 39, you are in menopause, then egg quality will be lower. If your periods have started to stop, you need to work on your health. If you don't have a practitioner, then find a practitioner, start working on your health and well-being. That's the first step. You have other children, or this is first time you're trying? Delhi's Delight, your blood pressure is right now low. I'm talking about when you are pregnant with diabetes. Sabah, hi, hello. I took letrozole and ultrasound has no follicle. What does that mean? That means there is no follicle. Letrozole did not release any follicles, any eggs. That's what it means. Any suggestions for prenatals? Health is the biggest suggestion for prenatals, and if your blood has been tested and you have had blood tests to check out the level of vitamin D, level of other levels of vitamin B, and all the other vitamins and minerals, and if anything is lacking, that's what you should be supplementing, not just mindlessly supplementing. Online prenatal, there are many of them. Okay, if you're looking for prenatals or any vitamins or any supplements that you want to take supplement which is a little bit more on the expensive side. And I'm not trying to highlight money issue here, but the cheaper supplements of any kind, they are not as effective because they don't have enough in them, or they don't have the good ingredients in them to support you. First, start from your health, your diet, lifestyle, get the bloods tested, and then looking at the blood, what is required, then you take the prenatals. I've already got one child and he's healthy, but I want one more child. It's the same principle, right? You have one kid, two kid, three kid, fourth kid, however many times you want to get pregnant, you have to go through your health, because eventually it's you who's going to have to be healthy enough to be able to sustain that pregnancy. The fact that you have got one child doesn't mean that your body is still capable to sustain another pregnancy. La Clem, hi, hello. I have PCOS. I took letrozole but haven't seen in my period, and I'm not pregnant. What should I do? You should look at your gut health. Have you ever looked at your gut health? Should I move for trigger shots? Sabha, that's for your doctor to decide, right? Trigger shot you can't take yourself. So if your doctor thinks you should have a trigger shot, you should have a trigger shot. Lillian, doctor, what can be the cause of smelling discharges before and after period? There should not be any smelly discharge before or after. If that is the case, then that's not natural or normal. That needs to be investigated. Good evening, everybody. My name is Ashish. My clinic is called Ashish Veda. We are a natural bespoke fertility care, natural fertility care clinic in central London in High Street. We are based in the UK, in United Kingdom. So if you are in England, United Kingdom, it is easier for you to get us services if you are looking for natural solutions for your fertility, which is Ayurvedic medicine, herbal medicine, Ayurvedic therapies, natural therapies, fertility massages, natural herbal colonic therapies. If you're looking for any of those, then our clinic is based in Harley Street. I also do work with international patients. If you are around the world, you can have a consultation online like this. Then we send you medications. If you choose to have medications with us, then we send you herbal medications, Ayurvedic medications around the world. We post them to you. And if you want to take coaching, then I coach online just like this. So coaching every week. And if the only part that you cannot do when you are not in England is the therapy part, so that we can source a local clinic who can do fertility treatments for you, and you can still take other guidance from me. So that's how it works. If you are looking for a fertility coach, a consultant, a natural practitioner who can support your health, somebody who has done this for 10 years, which is me, then you can reach out with your name and email, right? Anita, I just mentioned. Z Nation 67, how much folate should I aim to get? Did you understand my answer? That you need to first get your blood test? Yes? And then use this? Eat, please, nutritious food. That is the best supplement. Pardon me. Your nutrition, your food, the organic food that you eat every single day is the best nutrition. What you should be looking at is how can you optimize the food that you eat? How can you make that food more suitable to your body type? Most of the people, the food that they're eating, they're not digesting very well because most people have digestive health issues. So the food that you're eating is 50% of it is not digested. So many people are constipated. So that food is sitting and rotting in your gut. So the things that you should be looking at, and that is one of the reasons why you're looking at supplements, because the health itself is not functioning very well. So the health itself has to function so well, and the starting point for that is understanding what kind of gut do you have, what kind of body do you have. Do you understand? Do you have a cold body, hot body, phlegmatic body, fast moving body, slow moving body, fast gut, slow gut, inflammatory gut? What kind of gut do you have? And then knowing what kind of foods based on your gut can you eat. If you're eating all the good nutrition and you're digesting really well, you don't need a supplement, right? And even if you do, you need supplement for shorter. Supplement should be for 3 to 6 months. That's what we need supplement for. Not that most of the people relying on supplements as if it is that's food. Okay? So that's not the way to go. The way to go first is your health, your gut, your lifestyle, your cooking methods. All of that can be optimized. And then when you are absorbing enough nutrition, then you need least amount of supplements. Yeah. I hope that makes sense. It makes sense to me, and that's why I'm sharing it with you. I hope this makes sense to you as well. Do you help for PCOS? Yes, we do. We help patients with PCOS, endometriosis, any kind of gynae situations which is related to you not being pregnant fast enough, or that if it is not for pregnancy but otherwise you just want to have a healthy menstrual cycle for those reasons as well. What kind of test will tell you about your gut? A few questions will tell me about your gut. Tell me about your gut. What do you eat? Tell me the timing of your food. Lunch, breakfast, dinner. Breakfast, lunch, dinner. What are the timings? How many stools in a day do you pass? You don't need that many tests. You need some basic questions first to understand. Then work on it for a week or two will give you different result. If it doesn't, that's when we start investigating a little bit more deeper. How can I reach you? Sabha, you can message me directly here. You can also message me via my website ashishveda.uk. There is a section to book a consultation if that's what you're looking for. Then you can reach out via there, or inquiry@ashishveda.uk. ENQIRY, inquiry@ashishveda.uk. Breakfast around 8, lunch 12, dinner around 7. Right. Is it 7? Is it before 7? After 7? Stools has gotten better because I prioritize fiber, right? So stools were not good, right? So if stool is not good, that is a big factor for what you can absorb. If whether you're constipated, or that you have loose stool, or that you have got stool itself which is not healthy, yeah. If you have got any kind of indigestion, you have got belching, you have got bloating, this is not natural. Healthy gut does not do that, yeah. And even if you're having constipation kind of once or twice a month, even that is not a good sign, yeah. So those are the things you need to start working on and optimizing. And where is that gut health coming from? It is coming from the habits of eating. It is coming from the habits of cooking. It is coming from the oils that you're using to cook, the ingredients that you're using, the kind of foods that you're eating. Good. Stool has gotten better. So what was it before? Constipated? Thank you everybody for being here, for sharing, liking. Thank you so much for sharing the live, to put it in front of other women who are trying to get pregnant right now and not getting anywhere, or you have your own health issues, or that you're thinking that what test can I do? What supplement can I take? First point is, how can I make myself healthier? And if you're doing this on your own, you need to think about, who can I find? What kind of practitioner can I find who can tell me how better to eat, how better to sleep, how better can I do things in my daily schedule that gives me more health. Yeah, these are the questions that you should be asking, not that what supplement can I be taking. How to hyperovulate? Why do you want to do that? So Z Nation, you were constipated before, correct? How many years were you constipated for? Subhan, why would you want to release multiple eggs? When you release multiple eggs, the quality of the egg is not going to be there, right? Because remember, nature is releasing one egg per month. Yeah. You want twins. That's not how you get twins, by the way. Stellar Muse, my sister wants to conceive, but her husband is weak. What do you mean weak? He has got sperm quality issues, sperm health issues, yeah? So he needs to work on improve his health. Maybe a year, right? Z Nation, you need to work on your gut, yeah? Nobody should be constipated. So anybody who has got constipation, even once a month, is a tiny red flag. But if it is more than once a month, it's a huge red flag. That means anything that is going in the digestive system, it is staying there. And when it stays there, it is going to start causing inflammation that builds and builds and builds, right? And that is not good for your overall gut and all other immune system. It is not good. Your immune system gets down. Every other system gets down because immune system is down. Down means that it's not performing very well. Your gut is not performing very well. And then your uterus, which lies very next to the gut, starts to pick on that inflammation because it starts to absorb whatever is there in and around the gut. So work on your gut health. That's the biggest. Not just only the fiber. Find a practitioner with whom you can work on your gut health, right? Stellar Muse, your sister's husband need to find a practitioner who can improve his health. That's what she needs to do. Can PCOS be cured? The tendency of PCOS cannot be cured, but you can be symptom free. The power of prayer. Hi, it's my Nightingale. Right. Liver. What about liver? How can you improve gut health? That's what I was talking about just now. Can I get pregnant with PCOS? Short answer is yes, you can get pregnant with PCOS. But if PCOS is, the symptoms of PCOS are very much more on extreme side, then, and if you're not ovulating, then chances are less. And the egg quality is not there, even though there are multiple follicles, but the quality starts to reduce. So it is working on your, again, gut health. With PCOS, that's what you need to improve. You also need to improve overall health as well, so that you start to ovulate. The more chances there are you ovulate, the better chances you will get pregnant faster. Time to go. Thank you so much for being here. You can check out more stuff. You can check out more details. You can check out patient case histories and testimonials and stuff on my website ashishveda.uk. ashishveda.uk. And send us an inquiry via that. Natural fertility coaching, the next sessions, 12-week sessions, are starting on the 4th of April. First 4 weeks are free for everybody who's asking questions here. Free for you. For you and your partner, both should join. Learn something really basic, foundational, fundamental to your health, which is your health, your body mind type, your personality type, and the foods that you can eat or not eat according to your constitution. Yeah. That's what we are doing starting on the 4th of April. If you want to join, inquiry@ashishveda.uk. Send an email now and then I will be able to send you details. We have about 16 women and men, some couples and some women who have already joined, who have already said yes. So you can also join and learn some more deep natural health stuff. Can PCOS conceive naturally? Sure. Shah Khan, hi, hello. How can I improve gut health? To improve gut health, you have to eat on time. You have to eat the right kind of food. You have to cook the right kind of food. You have to use the ingredients which are good, healthy ingredients. You have to use the oil, the fat that you use to cook, the healthy fat like ghee or olive oil. You also have to make sure that the pots and pans you use are not non-stick, not non-stick pans, and you have better pans, healthier pans to use. You also have to make sure there is all fresh ingredients that you are using, and it's the consistency of your mainly the meal times that is then gives you the consistency of your health. And slowly then health starts to balance. Literally within 2 or 3 weeks you should be able to see the results of it. And then it goes deeper into what kind of foods are good or bad for your gut, for your personality type. So that's the starting point. Is it making sense? Does that make sense to you? And the biggest sign, one of the biggest signs, a few signs of gut health. The biggest sign is passing stool every single day. At least once. Yeah. Passing at least one stool every single day. Passing more than once is healthier, and the stool has to be nicely healthily formed, as well as there is no indigestion, there is no bloating, there is no wind, there is no belching, there is no heartburn. All of these things, no. If you're having any of those things once or twice a year is what can be called, okay, you ate something which caused it. Yeah. But if you have a very healthy gut, they should not even be there, even once in a 6 months. How to regulate period naturally. Okay, before I go, thank you so much for being here, everyone, and have a fantastic rest of the Saturday. In order to regulate your period, you need to regulate one, your blood sugar levels, because your blood sugar levels are connected to your hormones. If your blood sugar level is up and down, that means you are not eating at consistent times. It will not give you a consistent blood sugar range, and your hormones can never be then balanced. Secondly, if you're not sleeping on time, as well as if you're not sleeping very deep. If you're not having very deep restful sleep, you're not balancing all the hormones that need to be balanced, which balances when you are sleeping very nicely 9:30 p.m. So that's what you need to do. Those are the starting points. First is consistent habits of meals, and secondly, very, very consistent sleep times. Right. Really help. Okay, thank you so much for your wonderful feedback. I'm pleased. Anybody who wants to reach out, inquiry@ashishveda.uk. There are free guides available on our website, ashishveda.uk. Get those copy of those guides. Start reading some natural, deeper, holistic medicine stuff. Understanding about your body, mind, constitution. Understanding about food. Understanding about egg quality. Understanding about somebody who's asking about the semen quality as well. How to improve men's health. So all those guides are available, and check out. The power of prayer, I actually do not remember, but thank you for your kind words. If my advice has helped you in any way, that is fabulous. Thank you so much. So, natural fertility coaching starting 4 weeks free, 4th of April, we are starting. So, if you are looking to join, if you want to learn some little bit more and want to know how can you get started in a better way and improve your health, then join us. Inquiry at ashishvida.uk. Thank you. See you. Bye bye.